On Chapter 8 with the skeletal system, today we'll start off looking at an overview of the skeleton. So we're going to divide the skeleton up between the axial and the appendicular skeleton. Then we're going to look at the different parts of the skeleton. So we'll start with the pectoral girdle, or the shoulder and the upper limb or the arm. We'll look at the pelvic girdle, or the hip and the lower leg. And then finally we'll look at the vertebral column, the thoracic cage, and then all of the bones that comprise the skull. So first off, with an overview, there are two regions that we can divide the skeleton with. So you can go ahead and look in your textbook at the figure where they color code these, but you have the axial and the appendicular skeleton. So if you think about the axis of the Earth, it runs between the North and the South Pole directly through the middle of the Earth, and of course we spin on that and have our daylight versus night hours. So with the axial skeleton, if you'll think about it, as this is the bones that comprise the middle or the major axial part or middle part of the body. So the central supporting structure of the body is referred to as the axial skeleton, consisting of course of the skull and the bones associated with it. You have three auditory ossicles, or inner ear bones. You have the hyoid bone in the neck, the vertebral column that runs of course down the backbone, and the thoracic cage that includes both the sternum or the breastplate and then also the rib cage. Then everything else outside of the axial skeleton, of course, would be the appendicular skeleton. So everything to the side, of course, that would be the bones of the upper limb and the pectoral girdle, and then the bones of the lower limb and the pelvic girdle. If you take the average, and again we use the term average pretty broadly here, but the average skeleton has 206 bones once you examine the typical adult skeleton. But there are variations. At birth we have around 270. Of course, we don't want to birth by natural childbirth means a skeleton that is fully ossified. So a lot of the fetal skeleton, of course, remains cartilage prior to birth. But in the average adult skeleton, 206 bones with certain variations. So you have an objective that asks you, well, what are the variations between the numbers of bones in the adult skeleton? Well, one of those would be sesamoid bones. The other would be sutural bones, once called Wormian bones. So notice that sesamoid bones are bones that occur usually in tendons, and these tendons are in these areas where you have quite a bit of stress on that joint. So these sesamoid bones will start to develop where you have ossification of the tendon itself. So sesamoid bones, like the patella, result there in the knee. The other example are sutural bones that occur in the skull. So if you'll notice a skull, when you start to examine it, you have the sutural lines where ossification has happened to make the entire cranium or skull cap form. So those actual sutures sometimes will have ossification in between, where the actual individual bones join together, the sutural joint is there, and it's in that joint that sometimes within that sutural line that extra bones would develop. So you also in your textbook have a table that starts to go through some of the surface markings where we talk about depressions where maybe muscles would lie. We talk about pores or openings where nerves or blood vessels would go through the bone. There are certain cavities within the body that exist, and bumps, ridges, or spines, or these projections on the bone surface. So not only are we identifying the major bones, but we're also identifying major surface features in the bone. So again, the axial skeleton is encoded in the figure as tan, showing the midline of the body. Everything outside of the axial skeleton is considered to be appendicular. So they show that to you in green. So we mentioned that some of the different anatomical features are the surface features of the bones. We mentioned that the indentions would be something like you have the fossa here, so the muscles for the shoulder could lie in that fossa, and then above this area that we call the spine. You can definitely see why it's referred to as a spine. You can also have other muscles that house that indention or that depression. I mentioned sometimes we have openings through the bone where nerves and blood vessels go through. That of course would be a foramen. Sometimes we have projections on the bone, so it could be something like a spine or a process, or sometimes they're referred to on the ends of long bones as condyles and epicondyles. And then, of course, areas that extend out on the bone, they refer to as the neck, and then the end of the bone as the head. Um, Again, sometimes you have areas or cavities within the body. Of course, we term those sinuses. So there's several different terms as you look through the skeleton that describe these anatomical features or these surface features on the bone itself. And of course, you're responsible for those. The next section, we're looking at the pectoral girdle, or the shoulder, and the upper arm and lower arm. So the shoulder itself, the pectoral girdle, is there by natural design to support the arm and for everything that we as humans use the arm to do. There are two major bones that form the pectoral girdle. You have, of course, the collarbone, known as the clavicle, and then you have the shoulder blade, known as the scapula. Notice that I've given you the joint names where several of these bones come together. And if you notice how the joints are named, it refers to the two bones and where they actually meet. So notice the sternoclavicular joint, you have where the clavicle then meets with the sternum. The acromioclavicular joint is where you have the acromion process on the scapula that meets with the clavicle. On the scapula, or the shoulder blade, you have it articulating with the humerus on the lateral side of the shoulder. So where the head of the humerus, which would of course be the ball, would fit into the glenoid cavity of the scapula, hence the term glenoid, forming the shoulder joint. So you have the sternoclavicular joint where the sternum joins the clavicle. You have the acromioclavicular joint where the acromion process of the scapula joins the clavicle on the opposite end, and then where the head of the humerus fits into the glenoid cavity, creating the ball and socket joint, or the shoulder joint. Of course, because of its design, it's very easily dislocated. The clavicle itself is an S-shaped looking bone, so again you have one end of it where it's going to attach to the sternum, and you see sort of the blunt area there. The other end is sort of S-shaped, and that's where the acromial end is, where the acromion process of the scapula would fit there. So by natural design, again, the clavicle is designed to stabilize the shoulder itself, the shoulder joint. If you've ever seen one that has fractured, like on the football field, their clavicle or their collarbone, their shoulder will literally rotate medially toward the midline of the body, so it doesn't stabilize it and allows the whole shoulder to rotate forward. And it is, of course, Dr. Saladin points out, one of the most frequently fractured bones in the skeleton. The scapula, again, it resembles a shovel because of its thin shape. It has three sides to it, three angles, so a particular design. Talks about that you have the suprascapular notch to it. The spine on the posterior surface of it is a major defining point for it because it separates the supraspinatus fossa, that's the superior portion of the spine where the muscles of the shoulder fit, separated from the infraspinatus fossa, where you would have the lower muscles of the shoulder that would fit in that broad indented area. On the anterior surface, you have a much larger fossa called the subscapular fossa. So when you identify and look at the scapula, you can identify several structures and features from the posterior side of it, but then some major features from the anterior side. Some of the other main features, there are actually three that we're responsible for. One of those is the acromion that we've mentioned that is articulated or comes to make a joint with the clavicle. You have the coracoid process, and then you also have what we've mentioned that articulates with the head of the humerus, the glenoid cavity. So let's look at each one of those. You have an extension of the spine that comes around on the lateral side of the joint. It articulates, we've already said, with the clavicle, and that, of course, would be the acromion process. Notice that it is the attachment of the scapula and the upper limb to the rest of the body. The coracoid process actually looks like a bent finger on that same end of the scapula. This is where most of the tendons that are going to attach your biceps brachii and the brachialis and some of the other upper arm muscles to the scapula. So the coracoid process, looking like a bent finger, and it's directly associated with the glenoid cavity, beneath it, inferior to it, and then also the acromion process. So we've already said that the glenohumeral joint is where the head of the humerus fits in to the cavity. So it's much easier to look at this in lab and notice all of those parts. So we said like a bent finger would be the coracoid process. So that's here. You have the acromion process. And then we said where the head of the humerus fits into the glenoid cavity. We mentioned with the fossas that anteriorly you have the subscapular fossa. Posteriorly you have two. You have the supraspinatus fossa and you have the infraspinatus fossa, separated by this large spine, and at the end of the spine, of course, you have the acromion, again from the posterior view. With the upper limb, there are 30 bones altogether. Of course, you have a right and a left arm usually in normal anatomy. So remember back to lab exercise 2, we have the brachial part, or the arm itself. The antebrachium is the forearm. Remember the carpals are the wrist, and then you have the hand or the manus. So altogether 30 bones in the limb. Starting with the humerus, it has the proximal end of it, where you see a almost hemispherical head to it, very small neck region, not like the femur in the leg, but still a neck region called the anatomical neck. You have greater and lesser tubercles that are associated with it, and then you have an area that's listed here called the deltoid tuberosity. So again, for the deltoid muscle of the shoulder to have its insertion point, or where it's going to actually pull on the humerus when you rotate up your shoulder. The distal end of it has an area that's called the capitulum, and it's hidden behind here. So you have the capitulum, and then you also have the trochlea. So on the opposite side then, you have the area called the trochlea. So I put this in alphabetical order. If you have the capitulum for C, matches up with the radius. So in the alphabet, C and R are closer together. The trochlea on the opposite side matches up with the ulna. So T and U are closer together in the alphabet. Associated with the capitulum and the trochlea, you have the epicondyles. So you have lateral and medial. And again, if you've already concreted those terms, lateral, of course, would be the outer edge. Toward the midline of the body would be the medial epicondyles. There's some subcondylar ridges associated. The other big feature is this one, the olecranon fossa. So this is going to allow the olecranon process of the ulna to fit into an indention or an area with the olecranon fossa on the humerus, so you can actually extend your elbow out 180 degrees. The coronoid fossa is also there, and the radial fossa, where the head of the radius will rotate out there in the elbow. So we have supination and pronation, turning of your lower arm, because the radial fossa on the humerus allows the head of the radius, which is spherical, or not spherical but circular, it allows for rotation. You have two bones in the lower arm or the forearm, the radius and the ulna. So I always try to point out that, again, we've already mentioned that the capitulum then articulates with the radius. So the capitulum that's on the humerus would articulate with the radius. Also, if you think about it being on the thumb side, and if you look at your thumb, hold your hand out, you can literally turn your thumb in a circle. So circle, think what? Radius. So on the thumb side of the lower arm would be the radius. Associated with the radius, you have an area called the styloid process. So if you actually will examine the radius, it does have that rounded, I said spherical, but it's not like a sphere, but it is a rounded type head, and at the opposite end you do have the actual extension of it in this area called the styloid process. So that's one to remember. The ulnar notch is also there, again, because it articulates to its side with the ulnar portion, or the ulna itself, and that portion of the distal end of the bone articulates together. So speaking of the ulna, you have a couple of different things. So you have the trochlear notch, so that of course that's where the trochlea from the humerus articulates with the ulna. You have the olecranon. That's actually what you feel with your elbow, is the olecranon process. So this proximal end of the ulna, called the olecranon, actually forms the elbow. You have something called the coronoid process that also helps form the elbow. You have the radial notch, where again the head of the radius, being rounded, can move back and forth, and that allows for you to move your hand back and forth with supination and pronation, and we'll talk about those terms in chapter 9. And then it also on its end has a styloid process. So you have a styloid process on the radius that we talked about. You also have this one on the ulna. Since both bones are in the lower arm and they both function to allow the lower arm to move as one unit, remember we have connective tissue in this area forming the interosseous membrane. So you see it in the posterior view, you see it in the anterior view, where the interosseous membrane attaches the radius and the ulna together. It allows both of those to share the load of the elbow and to move, again, your lower arm, the forearm, back and forth with the different types of movements, to put palm out or to put the palm back. The carpal bones of course are the bones that form the wrist. There are 8 of those that are there. So 2 rows with 4 bones in each. So if you look at the proximal row, and this is the one that Miss Sundenstein come up with, so if you want to use that one, Shirley left the party to take Charlie home. The one that I have is an alternate to that, is Todd Toller came home, saw lavender toilet paper. Okay, and this was actually when I was in my anatomy class that my professor had this written on the board. So I had walked into the room that day and he was about to lecture on the skeletal system, and I noticed Todd Toller came home, saw lavender toilet paper, and for about 30 minutes while he began his lecture on the skeletal system, I was wondering, what in the world was going on. But when he started to talk about the carpal bones, talking about the 2 different rows, the proximal and the distal row to it, and then he lifted up the screen, and there you could see Todd Toller came home, saw lavender toilet paper. So of course that would give you the distal row and then the proximal row. So Shirley left the party to take Charlie home would be proximal. Actually, I guess she would be distal and proximal also. So either mnemonic that you want to use can help you find those particular carpal bones. 2 other things that I'd like to point out, though, is that you have an extension on the pisiform, and you also have an extra piece on the hamate. So notice it says that the pisiform is a sesamoid bone that starts to develop by the time you're in your early adolescence within the tendon that's in the lower arm. So I always like to find the pisiform first, and then if I use either mnemonic, I can figure out the rest of those, because the pisiform is next to the pinky, and you actually can feel that there in your wrist. Directly above that is the hamate. So if we label those, you've got the pisiform and the hamate. So if we can put the rest of these in order. So again, you have Todd Toller came home, and then saw lavender toilet, and then paper. Or if you Shirley left the party to take Charlie home. Notice that on your distal row you have the trapezium, then the trapezoid. So you have to put those in alphabetical order. So you have to go all the way to the I and the O to see which one comes first. Well, trapezium with the I comes before trapezoid with the O. Then, of course, next to that you would have the capitate, and then I mentioned that the hamate is directly above where the pisiform is, and pisiform, make that distinction that it's there at the pinky side of the wrist. The proximal row, you would use that saw lavender toilet paper, so that you have the scaphoid, then the lunate, then the triquetrum, and then the pisiform. So again, especially with the carpal bones, it's going to make a little bit more sense if you take an articulated skeleton where the carpal bones are still in place, look at their relationship to the metacarpals and the phalanges, look at their position to the radius and the ulna there in the wrist. It's going to make much more sense to you. The manus, or the hand, this is the one that has the other 19 bones. So of the 206, a lot of them are in the hands and the feet. So there are 5 metacarpal bones, starting with your thumb, go into your pinky would be number 5, and then you have 14 phalanges. So you have 3 different digits with the phalanges.